Affordable Care Act, and I just call it Obamacare, I just give it and call it Obamacare, is it in critical condition? And you know, my response to that is no, it is not in critical condition. It is alive and thriving, but it does have a chronic condition. And the chronic condition, and those of you who have chronic conditions know what I'm talking about, you can survive and thrive well with a chronic condition. The chronic condition that the Affordable Care Act has is political partisanship. It is amazing that a law that presents exchanges that provide people a transparent place to purchase coverage, a law that gives you tax credits as subsidies so you can afford to buy coverage in this new regulated market, and that has an individual mandate, is being opposed by Republicans. Those are all ideas Republicans have been putting on the table for 2 decades, including Governor Romney. So there's clearly the chronic condition that is hurting Obamacare is political partisanship. And you know, you can see the symptoms of it. You can see Republicans ranting, delusional ranting, I think you could call it, about socialism and government takeover, and those things just aren't true. It must be the fever of partisanship that's creating these problems. And you see a rash of people, if I can use that bad analogy, who, when told what is in the law, what the provisions are, some of the ones that have already been mentioned, they actually embrace the law, but then they hate Obamacare. So there's sort of a layer of mental issue involved in this chronic condition too.
It really is a town that has been on a trajectory of amazing recovery and now improvement, and one of those areas that we have been spending a lot of attention and time on is in healthcare, because we have a history of the exaggerated issue that the country has faced, where we have insufficient access to care that's unequal based on the color of people's skin and the kind of insurance that they have or don't have. We have had a history of inadequate access to quality care, and like much of the country, been spending resources in places for care like hospitals and emergency rooms, which is really not the place that you want to invest in people's health care. You want to do that in prevention and in primary care to keep people well. What the Affordable Care Act does is tackle those things. It is an opportunity to take on a much larger scale what we have been working on in a micro way in New Orleans since Hurricane Katrina, and that is to expand access, not just access, but access to quality care in neighborhoods. That's primary care, that is a place where people know you and really embrace and wrap services around people so that they are culturally appropriate and meet their needs, but do it in a very efficient and effective way, because that is possible.
I think it's helpful to recognize that when President Obama achieved, with the help of the Congress, the Affordable Care Act, that the thrust that the nation ought to have a national policy around health had been 50 plus years in the making. It was actually Harry Truman who first proposed national health insurance. And along the way, obviously there was Medicaid and Medicare, there was the state children's health insurance program, there was a prescription drug benefit program, there were efforts by Bill Clinton to do additional things. It was a long time in coming as the United States lagged in the industrial world as that nation that did not have a comprehensive approach to providing health care coverage to all of its citizens. That's number one. Number two, when I ran for office for the first time, now 22 years ago, the subject of national health insurance was a hot topic. At that time, the United States Chamber of Commerce, the United States Chamber of Commerce, their policy proposal was the individual mandate proposal that was a central feature of President Obama's plan. The Democratic plan at the time was a single-payer approach. It's very interesting how the political pendulum now treats the individual mandate, which was the plan that was supported by the business leadership of the United States 20 years ago, as somehow being outside of the mainstream. So I think it's important for all of us to understand the current dispute in context. Number two, to the question, Justice Kennedy, the court, if Justices Kennedy and Scalia voted in this case consistent the way they have voted in other cases that involve the interpretation of the Commerce Clause, then it would be more than 5 votes in favor of this bill.
Right, that the whole fight to get the Affordable Care Act, to get health insurance coverage, was hung up on women and women's access to reproductive care. But I think one of the most interesting examples that we've seen recently, so at Planned Parenthood, we provide health care to 3 million people every year, and the vast majority of that care is preventive care. And right now, as many of you have seen, we are fighting over whether or not women should get coverage for birth control in insurance plans. Literally, family planning, which is birth control used by 99% of women in this country, this Congress is now trying to take away that right, even though every woman uses it, saying that fundamentally they don't agree. It's exactly why things like the Affordable Care Act have to exist, to frankly protect the people from the politicians and to be at that higher place. And it goes state by state. I think Marc's example of Medicaid is really good. If you look at the Affordable Care Act, so 34 million more people are going to get insured. Half of those are going to be newly insured under Medicaid. Half of the new Medicaid eligible folks in this country are here in the South, okay? So it is not that there is not equal access in this country. That's what the Affordable Care Act has been about for women, for young people, for people who are uninsured. And if you start saying, well, Congress doesn't have the right to make sure everybody in this country has access to health care, then you're going to have safe states and not safe states in this country. Women are going to have different rights in different states. Young people are going to have different rights in different states. And as a country, we're going to be going backwards, for decades. And so this decision needs a lot more than the individual mandate, than health, than this one act. It needs whether or not we as a country can actually move forward.
And Marc's point that obviously the individual mandate was at one point the position of the Chamber of Commerce, in part because what it does is mandate that people buy a product that, businessmen are selling for a profit, right? It does seem to me that the individual mandate is the basis for allowing, as Cecile pointed out, the important issue of pre-existing conditions. That you cannot mandate coverage of pre-existing conditions without an individual mandate. That, for those of us who took Insurance Risk 101, right, it's a moral hazard. The whole issue is you have to be able to spread the risk. You can only spread the risk if everybody's in the pot. And so I hear you, obviously Affordable Care Act is enormous, but it does feel to me like one of the most popular aspects of it, and perhaps the part that also has the greatest impact on those who are already ill, those who are poor, women, is the ability to get coverage with what we would have once called pre-existing conditions, and that does go away without the individual mandate.